Hello everyone, welcome back to the AY tutorials. Today we are going to study the detailed information about the organophosphorus poisoning. It is also known as OPP poisoning. So let's get started. First of all, we need to understand what exactly the organophosphate poisoning is. So the definition of organophosphate poisoning, it is a severe medical condition which resulting from exposure to the chemical compounds called as organophosphates. Means whenever the person is get exposed to that chemical known as organophosphate, then this poisoning can happen. Then sources, these organophosphates, they are primarily found in the pesticides and insecticides which are used in agricultural and domestic use. Then chemical warfare nerve agent, that is sarin and tabun. Crisis, what are the different crises after having this organophosphorus poisoning is organophosphate poisoning is a cholinergic crisis and overstimulation of the entire nervous system. Then global impact, a major public health issue, especially in the agricultural regions, often leading to high morbidity and mortality. So this organophosphate poisoning, it stimulates or the overstimulates the entire nervous system. This is the crisis of this poisoning. Then the next one is the toxic mechanism, inhibition of acetylcholinesterase. The key molecular event, organophosphates, they irreversibly inhibit the enzyme acetylcholinesterase, that is ACHE. Then normal function, acetylcholinesterase, it rapidly breaks down the neurotransmitter acetylcholine at the nerve synapse. Then poisoning effect, organophosphate binding to the ACHE, it stops this breakdown causing the massive accumulation of ACH. ACH at the synapse, it continuous nerve signal transmission and overstimulation. So because of the overstimulation, or we can call it as a over accumulation. So because of this over accumulation, this overstimulation of the nervous system, it occurs. So ACHE is the responsible factor. Reasons for exposure to these organophosphates, route of exposure, occupational, regular handling of these pesticides in the farming or manufacturing settings. For example, dermal absorption from the contaminated protective gear, inhalation of pesticidal spray. Then intentional or suicidal, deliberate ingestion or by the oral route due to the easy accessibility of the pesticides. This pesticide is accessible easily because of that. Then example includes most common cause of severe organophosphate poisoning in many developing countries. Accidental, misidentification or the improper storage or the consumption of contaminated food or water. Then children's accessing improperly stored household pesticides is the example. Then terrorism or warfare, in that exposure to highly toxic organophosphates nerve agent, for example includes sarin gas attacks. Acute effects, in that muscarinic overstimulation at the receptor site, parasympathetic postganglionic nerve endings, smooth muscle glands or heart. Then symptoms, dominated by excessive secretions and smooth muscle contractions. So secretions are increased and smooth muscle contraction occurs. Then mnemonic, in that slugem or dumbness, salivation, lacrimation, urination. Then defecation, gastrointestinal cramps, and emesis, it is nothing but the vomiting. Then meiosis, which is pinpoint pupils, pupil size decrease like pinpoint. Then Bronchoria, it is nothing but the excessive fluid in lungs and bronchospasm. These are the some signs and symptoms of this acute organophosphorus poisoning. Acute effects in that nicotinic and CNS effect. Okay, nicotinic effect. The site is neuromuscular junction, skeletal muscle. Symptoms includes muscle fascination, that is twitching, then cramps, then severe muscle weakness which leads to the flaccid paralysis. The nicotinic site is autonomic ganglia. In that, key symptoms are early tachycardia and hypertension, transient hypertension. Okay, then central nervous system, that is CNS, and the site is brain and spinal cord. Symptoms includes anxiety, confusion, seizures, then coma, and crucial respiratory depression, that is loss of breathing and drive. Okay, then life threatening consequences. The overarching lethal risk, respiratory failure, as we have seen it before. Respiratory failure can be there. Then combined mechanisms, airway obstruction from the bronchoria and bronchospasm, muscarinic effects, uh, then paralysis of diaphragm and respiratory muscle, nicotinic effect, then depression of a respiratory center in the brain, CNS. Respiratory failure is the leading cause of death in the organophosphate poisoning. Delayed and long term consequences. Intermediate syndrome, onset is 1 to 4 days post exposure. In that, proximal muscle weakness, especially neck flexors and respiratory muscles includes. Prognosis includes it requires prolonged mechanical ventilation. Then delayed polyneuropathy after 2 to 3 weeks post exposure. It includes weakness and paresthesias, pins and needles in the extremities due to the axonal damage, and it can be permanent or it may take some months to resolve. Then neuropsychiatric sequel, it may be long term, onset may be long term. It includes cognitive defects, memory loss, depression, and other psychological effects, and prognosis can be variable. Treatment strategy, triage and supportive care. Goal is to stabilize the patient, decontaminate and administer the antidotes. Resuscitation, in that prioritize airway, breathing and circulation, that is nothing but the ABC, airway, breathing and circulation. Secure the airway. First of all, in that initiate the mechanical ventilation immediately if signs of respiratory failure exist. Then decontamination, in that critical for dermal exposure, quickly remove all the contaminated clothing. Wash the skin and hair thoroughly with the soap and water to prevent the further absorption of the poison. Then seizure control, administer the benzodiazepines, for example diazepam and lorazepam, to stop the seizures and agitation. Then antidote focus, atropine is the antidote for organophosphate poisoning. Class of this atropine is competitive muscarinic receptor antagonist. Mechanism of action of atropine in this poisoning is it competes with the excess ACH to block the muscarinic receptor sites, because the accumulation of ACH is there, as we have seen it before. Then primary effect, it includes reverses the excessive secretions and smooth muscles. Effects are it dries the secretions, that is bronchoria. As we know that there is increase in the secretion when it comes to the organophosphorus poisoning, and it atropine is dries the secretion. Bradycardia and reverses the bronchospasm. By drying the secretions, it reverses the bronchospasm. Administration, this atropine is given IV in the high doses, titrated until the secretions dry up and heart rate returns to the normal. Limitations, does not affect the nicotinic, that is muscle paralysis or the CNS effect. Antidote focus in that pralidoxime. For the organophosphorus poisoning, these two antidotes are there, atropine and pralidoxime. Class of this antidote is acetylcholinesterase, that is ACHE reactivator oxime. Mechanism, it includes it acts as a biochemical antidote by binding to the organophosphate molecule and releasing the ACHE enzyme, effectively reactivating the ACHE. Crucial effects, it reverses the nicotinic effects, especially in the life threatening muscle weakness and paralysis. Then time sensitive, it must be given early because the organophosphates, it bond and can become the permanent, the process called as aging over the time and making the ACHE irreversible and unresponsive to the pralidoxime. So this pralidoxime, it should be given in a very short period of a time after the poisoning occurs, because if it becomes permanent, that is over aging over the time, then it becomes irreversible and unresponsive to the pralidoxime. Here we will see the summary and conclusion. Mechanism is the irreversible inhibition of ACHE, right arrow ACH accumulation, cholinergic crisis is there. Antidote, atropine and pralidoxime antidote is there. Atropine for muscarinic effect and pralidoxime is for the nicotinic effect. Lethal risk, respiratory failure is there due to the increase in the secretions, bronchospasm and paralysis. In that, mechanical ventilation and high dose atropine can be given. Antidotes used, atropine for muscarinic blocker and pralidoxime as a reactivator. Benzodiazepines for the seizures. Antidote benzodiazepines can be given for the seizures. Prognosis, it depends on the dose, time, treatment and agent toxicity. Early aggressive care is essential as pralidoxime must be given before the aging. Here we are done with the organophosphorus poisoning. We have seen all the information of the organophosphorus poisoning. If you like this video, please like, share and subscribe to the AY tutorials. Thank you.